easy. Well, Mike, that's a hard act to follow. There are two hard acts to follow here this morning. You know, at the National Center for Policy Analysis, we have a relationship with Václav Klaus, who, can you all hear me in the back? Václav Klaus is the president of the Czech Republic. Until recently, he was the head of the European Union as well. And I was over in the Czech Republic about a year ago, and I'm speaking to a group about this size. But they didn't speak English. I don't speak Czech. So I had a translator, and he says, what we're going to do is serial translation. He says, the way this works is you speak, and then you stop, and then I'm going to translate. And then you speak some more, and then you stop, and then I'll translate. And I said, that sounds fine with me, but how do I know when to stop? He says, well, I'm going to tell you. So I got up and I began speaking. I looked his way. He didn't say anything. And I spoke some more. I looked his way. He still didn't say anything. And I probably spoke for 15 minutes. And then he said, stop. And then he got up and he said something in Czech that I didn't understand, but it couldn't have been more than just a few words. So some polite applause. He said, you may continue. So I spoke some more, and I looked his way, and I kept speaking. I went another 15 minutes. And then he said, stop, and he got up, and he said something else in Czech, again, not more than a sentence. And this time the applause was a little louder. And he says, now you may continue, which I did, and I finished the talk. And then he got up and, again, said just a few words in Czech. Now I got a really nice round of applause. And, you know, as people were leaving the room, I pulled him aside and said, you know, I'm really impressed by your ability to summarize so economically the things I had to say. I said, well, how did you do that? And he said, well, that was easy. He said, after the first 15 minutes, I got up and said, he hasn't said anything yet. Then on the second go-around, I said, still nothing to report, but he's almost done. And then finally, it's over. We'll try to do better here this morning. You know, if you Google the John Goodman Health Policy blog, you're going to discover two things. First of all, you're going to discover that this is just about the only right-of-center health policy blog on the whole internet. Certainly, it's the place where conservative free enterprise ideas on health care are vetted by people all across the intellectual spectrum, right to left. It is also the only health policy blog, right or left, that has a sense of humor. And I don't know what it is about the field I'm in, but they're all a bunch of sourpusses. And not only do they not have a sense of humor, they don't even know when I'm joking. Paul Krugman's a perfect example at the New York Times. You know. I mean, he doesn't know when we're doing the satire bit. So we have this little yellow yield sign that we put up for the humor-challenged people, and it's a sort of alert to them that, you know, don't take completely seriously what we've got today. We feel like if we don't make you smile once a day at our blog, we're not doing our job. And we do things like, we had a post the other day about how Obamacare is going to push all of you into HMOs and they're going to ration your care. And then underneath that, we got Aretha Franklin from YouTube singing Say a Little Prayer for You. And then we had a post on end-of-life care. We had Bob Dylan singing Knocking on Heaven's Door. And sometimes we're accused of being really insensitive. We had this great exchange the other day about managed care, and we had the doctors arguing with the insurance folks and just went back and forth. Finally, this doctor says, you know, you managed care people are killing our patients. And that was a little strong, I thought. But it was so interesting, I repeated some of the comments in a blog the next week, and underneath that comment about killing the patients, I had Leslie Gore singing, You'd Cry Too If It Happened to You. And probably the most insensitive thing I've ever done, and some of you will remember this, about a year or so ago, a man went down to Parkland Hospital, waited 19 hours in the emergency room, and he died before he ever saw a physician. You remember that? And we thought this was pretty tragic. We also thought this could happen in other cities too, and so we did something at the blog about it. But then underneath that, I had Lionel Richie singing All Night Long, and I got flack for that. You know, the Affordable Care Act, what a lot of you call Obamacare, is the most radical piece of legislation in your lifetime. And this is a piece of legislation that's going to affect the health plan that all of you have. If you get health care from an employer, it's going to affect you. If you're on Medicare, Medicaid, it's going to affect all of us. We're going to have 159 new regulatory agencies. We're going to spend $1 trillion over the next 10 years. It's going to turn the whole healthcare system on its head. And given the enormity of all of this, I wonder if any of you are surprised by the way the White House is talking about it. Have you even noticed, by the way, that for the last 6 or 7 months, the White House hasn't talked about it at all? You ever hear Barack Obama talking about the health bill? Or how about Harry Reid or Nancy Pelosi? They aren't talking about it at all. But last year, when they did talk about it, it was almost equally surprising because they seemed to focus on the most trivial aspects of the bill. You probably heard Barack Obama a year or so ago saying, you know, once we pass this bill, an insurance company won't be able to cancel your coverage just because you get sick. You remember him saying that? He said it a number of times. And that's true. That's in the bill. But it's also true that's been the law for the last 14 years. You know, it's almost like the White House went through the books. They found a law they liked so much they decided to pass it again. And you've probably heard Barack Obama say, well, you know, once we get this bill passed, you won't have any caps on your lifetime coverage or your annual coverage. And that's true, too. And perhaps important, to the 1/100th of 1% of the population that's ever going to have that problem. You probably have heard him say, you know, once we get this bill passed in another 4 years, insurance companies won't be able to deny you insurance because of a pre-existing condition. But did you know that 90% of all the people in the country right now that have private insurance, 90% of them are right now in a plan that could not deny them insurance because of a pre-existing condition or charge them a higher premium? And of the other 10%, only 2 or 3% of those actually have a real problem. Now, the problems that I'm mentioning for the people who have them are serious and sometimes tragic, but in the great scheme of things, the public has never been told by the White House or the Democratic leadership in Congress or even by the healthcare reporters what this bill is really about and what it's really going to do. And what I want to do with you, just for the remainder of my time here, is I want to identify 6 really big problems that I think are so bad that the White House and the Democratic leadership in the Congress is going to want to go back and do something with this bill, even if there aren't any Republicans around, even if there aren't any critics. There's 6 problems that are so bad they just can't be allowed to continue. And the first of those is that you're going to have a mandate to buy a product whose cost is going to grow at twice the rate of growth of your income. Now, you don't need to be an economist or a mathematician or a CPA. You don't even need a pocket calculator to know if you're buying something and its cost is growing at twice the rate of growth of your income, eventually it's going to crowd out everything else that you're buying. Now, Barack Obama didn't create this problem. This has been going on for 4 decades. For the last 40 years, healthcare costs, healthcare spending has been growing at twice the rate of growth of income. And it's not just an American problem. It's happening all over the developed world. And we're not the worst country. In fact, our rate of growth, real per capita healthcare, is right about the middle of the developed countries. But we're all on an unsustainable path. And if we continue on that path, when today's college students reach the retirement age, we'll have crowded out everything else there is to buy. So the college students today will reach the retirement age. They'll have nothing to eat, nothing to wear, no place to live, but they're going to have really great health care. That's where we're headed. And I think most of you agree that isn't where we want to go. Again, Obama didn't create this problem, but what this bill does is it locks us onto the path. It makes it really difficult to get off of it. Because what would you do under ordinary circumstances if you had insurance whose premiums are going up faster than your income? Well, you'd go for the higher deductible, you'd take a more limited coverage, you'd do other things. This bill keeps you from doing a lot of those things. So it not only doesn't solve the problem, it locks us onto the path. Second big problem that nobody is really talking about other than my colleagues at the National Center for Policy Analysis, and that is just a bizarre system of subsidies that's going to really change in a radical way the whole structure of American industry. You take the hotel down the street, they've got a lot of people working there who make $15 an hour, and these are the maids, these are the waitresses, the busboys, the custodial people, the gardening people. $15 an hour is about $30,000 a year. That hotel is going to be required under the new law to provide health insurance that for a family is going to cost about $15,000 a year. So that's about half the cost of the wage that the employees are being paid. And there is no new subsidy in this act for this hotel or its workers. The only subsidy there is the subsidy that's in the current law, which says that if the employer pays premiums with pre-tax dollars, it can avoid taxes. But if you're only making $15 an hour, you're not even paying income taxes. So all you're really avoiding is the 15% payroll tax, and that's only worth about a little over $2,000 on a $15,000 purchase. So it's not peanuts, but it's nowhere near the cost of what the employer is going to be required to buy. Now here's what's really weird. Suppose the employer doesn't provide the insurance. Suppose he says, okay, I'm going to pay a $2,000 fine, and I'm getting out of the health insurance business. Well, then these employees can go over to a newly created health insurance exchange, and the federal government will pay almost all the premium for this $15,000 plan. And on top of that, it will reimburse the families for a lot of their out-of-pocket costs for a Congressional Budget Office estimate of a $19,000 benefit over there in the exchange. So you get the insurance through the employer at this income level. The government gives you $2,000 subsidy. You get over the exchange, you get $19,000. Now, I'm not an expert in labor law or employee benefits law, so I don't know all the things employers might be able to do. But the economist in me tells me that self-interest will find a way. And if it's $2,000 versus $19,000, some hotel is going to figure out it can make everybody part-time, or it can create a new corporation, put all the low-income people in separate corporation, or contract out to do something. But if it can get all the employees over there in the exchange, it will have a huge advantage, huge cost advantage over the hotel down the street. The hotel down the street will have 50% higher labor costs. And once one hotel does it, they all will do it. Now, the other bizarre thing about the subsidies is that when you get into the higher income employees, let's say you have a $100,000 employee over there, he doesn't get any subsidy in the exchange. But if the hotel provides the insurance, then you get the subsidy that's in the current law, which means the employer payments avoid the federal income tax. This is one of the few states that doesn't have a state income tax, but other places you have state, local income tax. And so the subsidy for the higher income guy in current law is worth almost half the cost of the insurance. So the rule of thumb here is if you make above average income, you're going to want insurance from an employer. If you make below average income, you want to be over in the exchange. And how do you do that? Well, I guess maybe corporations divide in two. Just create separate entities. One entity hires low income, doesn't provide insurance. The other high income and does. What's wrong with all this is you don't want the structure of American industry to be dictated by health insurance subsidies. You want people to form corporations, dissolve them, and do what they're going to do for economic reasons, not in response to health insurance subsidies. So the impact on American industry is going to be huge. A lot of businesses are thinking about it. The newspapers are not writing about it. The health reporters don't understand it. They don't understand tax law. They really don't understand much about health either, I'm sorry to say. And so the American people is not, you're not getting really prepared for all of this. Third big problem is that everybody who buys individual insurance will be going into the health insurance exchanges. In the exchanges, the health insurance companies will have to charge everyone the same premium, regardless of expected health care costs. Same premium for all. You don't even have to be in the insurance business to know that if everybody pays the same premium, you're going to make money on healthy people. You're going to lose money on sick people. So that tells you what? It tells you want to attract the healthy and avoid the sick. Federal employees are already in this kind of insurance system. Every year in the late fall, they have open season and they can choose a new health plan. They're all paying the same premium, though, regardless of age, regardless of health condition. You all have seen on TV advertisements from people selling real insurance, right? You've seen the actor standing next to the town that just got hit by a tornado, and he says, "You're in good hands with Allstate." You know, well, what is that commercial doing? That commercial is trying to tell you, we know you don't think about insurance until something really bad happens, and then we're going to be there for you. And that's why you buy insurance. And that's the way auto insurance, casualty insurance advertises. That's the way they sell. But in Washington, D.C., for the federal employees, you don't see anything like that. I mean, no health insurer talks about the bad stuff. They all show pictures of young, healthy families, and the implicit message is, if you're young and healthy and you look like the folks in this picture, we want you. And if you don't look like the folks in this picture, we're not sure we really want you. But certainly there are no insurers talking about AIDS or heart disease or cancer or anything else that's serious and difficult. So what you do is you convert insurers from the traditional business of insurance to people who are really just processing claims and moving money around, and you leave them with horrible incentives. And the first incentive is, of course, to attract the healthy and avoid the sick. But that perverse incentive doesn't go away once you enroll. I mean, once you get people in your plan, you know you want to keep the healthy people. You want to attract more just like them. So the incentive is to over-provide to the healthy. As for the sick, you didn't want the ones who joined your plan. You certainly don't want any more to be attracted to you. So your incentive is to under-provide to the sick. And this is probably the worst thing about Obamacare. There are going to be enormous pressures throughout the system to not give sick people all of the care that they need. And there are various ways that you can try to keep insurers from acting in their self-interest, but it's really, really bad to set up a healthcare system in which all the plans have a self-interest in not taking care of you. This is the last thing you want from a healthcare plan. Now, the fourth problem is on the buyer side of this market. You know, like Barack Obama said, you know, your health condition doesn't matter. You're going to pay the same premium. Well, why pay it at all if you're healthy? Well, there's some fine in the bill, but the fine is low compared to the cost of the insurance, and it sounds like they're not going to enforce it very vigorously anyway. And we're going to have a situation like they have right now in Massachusetts, where increasingly, with each year, there are more and more people who remain uninsured while they're healthy, and then after they get sick, they enroll, and then they get their medical bill, they get their care, and they get their medical bills paid for, and then they drop the insurance. And they're called jumpers and dumpers. Okay? They jump in after they get sick, and they dump it after they get well. And if everybody does that, of course, insurance isn't going to be able to survive. If the only people in the plan are sick people, they're the only ones paying premiums, the premium is going to have to be really, really high. And eventually that will drive private insurers out of the market. Only the government will be left. Now I sat down with Mitt Romney about a year and a half ago. I said, Mitt, you could be the leader among Republicans on the health care issue, but what you have to do is you have to go out and say, here are the 2 or 3 things I did that were really good, and here are 2 or 3 things that I did that you don't want to do. And I wrote it down to him and for him, and I emailed it to him, and he still hasn't done it. But I think he could have been the hero here if he just admitted what they did wrong, and what the rest of them, and what Obamacare should not have copied, and what the rest of America should not do. Fifth problem is the fifth problem is that they way overpromised. And people think they're going to get health care that they're not really going to be able to get. And the estimates are that by 2014, we're going to insure 32 million new Americans, newly insured. And if the economic studies are accurate, these people will try to double the health care they have been getting. And this, to me, is what happens next is really bizarre. They're going to force all of you to have more generous insurance than you already had, or that you wanted even to pay for. So they're going to force you to be in a plan where you have a whole long list of preventive measures that you can have without any deductible or any co-payment, which means it's free to you at the time you get it. And of course, if you have benefits that are free, you're going to take advantage of them. And when all of you do that, what I'm now describing is a huge increase in the demand for health care. And yet there is in the Obamacare Act nothing to increase the supply. So huge increase in demand, no change in supply. We're going to have a big rationing problem. And the waiting is going to grow at the doctor's office, at the emergency room, and everywhere else that care is sought, especially at the primary care level. And in that kind of market, I can just tell you already, you don't want to be in a plan that pays less than what all the other plans are paying. If you're in a plan that pays below market, you're going to be at the end of the line. And what does below market mean? It means if you're a senior or disabled in Medicare, or if you're in Medicaid, or if we do what they did in Massachusetts, all the new people in the subsidized plans, they're going to be paying real low rates too. And what I'm describing right now are the most vulnerable parts of society. Now, when you think about all of this, if you go all the way back to the Democratic primary, what was the point of health reform? Well, more often than not, Barack Obama and Hillary Clinton and other Democrats who were running for president were saying, you know, we've got these people out here, they're vulnerable, they need health care, they don't have it. And that was the focus of their attention. And yet I think we're headed toward a world in which the vulnerable populations are going to have more difficulty getting care than they had before we had the reform. In other words, we're going to get the reverse impact. And I'm one of the few people predicting this, but I can tell you that Ron Anderson and a lot of people running, or used to run, Safety Net Hospital, they're very worried about what's going to happen, because not only do they see lots more people coming into their emergency room, but the government's going to take their money away from them that they now have to pay for that kind of care. The sixth and final problem has to do with seniors. And here the most charitable thing to say about the White House is they've just not been telling the truth. You all saw these commercials. Who's Matlock? Andy Griffith. Yeah, thank you. You've seen him on TV telling the seniors, try it or like it. Well, you're not going to like it, because what's going to happen is over half the cost of Obamacare is paid for by cuts in spending on Medicare. And what kind of cuts are we talking about? We're talking about lower fees to doctors and hospitals. Well, they're already below what Blue Cross is paying right now, and the chief actuary of Medicare says that by the time we get to the end of the decade, just 9 years out, if we do what's in this law, Medicare will be paying less than Medicaid. It means that the senior will be financially less desirable as a patient than the welfare mother. And most people in Washington think this cannot happen. That long before we get there, senior voters will be on the phone complaining to their congressman and say, "I can't find a doctor. You're gonna have to do something about this," and they'll just reverse the cuts, which means they haven't paid for any of this. But I'll tell you something else that's going to happen, and it won't require any act of Congress. We're going to have an explosion in concierge medicine. And just out of curiosity, how many of you already have a concierge doctor? Okay, several. And just about every group I talk to, there are a few people in the room who have everybody. You know what a concierge doctor is? A doctor, around here, they probably charge you about $1,500. And for that $1,500, the doctor talks to you on the phone, emails you, usually it's same-day service. You get primary care from this doctor. He becomes your agent in the system. You have to go to the emergency room. A lot of times they'll go meet you at the emergency room door. So the doctor then becomes your agent in the system. What a concierge doctor is a way around all the waiting and all the bureaucracy. And the more waiting there is and the more bureaucracy there is, the more valuable they're going to be. The one thing you're going to learn at our healthcare blog, and you're not going to see this anywhere else, is this very fundamental realization that the major barrier to care in the United States is the same as it is in Canada and Britain and all over the developed world, and it's not money prices. The major barrier to health care are the non-money obstacles. It's the non-price rationing. It's rationing by waiting. I mean, you mainly pay for health care not with money but with time. And when the time you have to use up to get care goes longer, then it discourages you and others from seeking care. And that's how we're rationing. And in addition to time by non-price, I mean, how long does it take you to get on the telephone to get somebody at the doctor's office to answer your phone call and give you an appointment? And then how many days do you have to wait before you get in to see the doctor? And then how long does it take to get from your home to the doctor and back? And then once you're there, how long do you have to wait for care in the doctor's office? Those are all non-price barriers to care. And they're the most important barriers. And they're going to grow a lot in the coming days and years. And it is the way we're going to ration care. And if you're on, well, the dermatologists are already doing this. There's a nice article in the New York Times not that long ago talking about the dermatologists with the Medicare patients, if you have a problem Medicare pays for, or a cosmetic problem that Medicare doesn't pay for. Two different telephone numbers. Two different telephone numbers. You call in for the Medicare treatment and you get voicemail. And your appointment will be, several weeks. You call in for the cosmetic treatment and a real person answers the phone, gives you an appointment really quickly. We're going to see a lot more of that. Can we have time for just a few questions? If you've said as many controversial things as I have said, I got to give people a chance to say something back to me on this. Let me just leave you this one thought that I always like to remind people of. Nobody cares about you more than you care about you. So when you're thinking about health care, if you control the money and you have the power to make your own decisions, this bureaucratic system is going to work a lot better for you than if you cede that money and that power to some impersonal bureaucracy. Just keep that in mind. Thank you. All right.
We have some microphones floating around, so if you've got a question, raise your hand and one of the...
Right back behind you.
One of the things that was talked about when Congress was passing this is that once a law is passed like this, or like any Social Security, whatever it is, it's almost impossible to get it undone. What is your thought about the ability of the electorate to elect more conservatives and get this thing undone?
It will be very, very hard to get it undone. Although I will say that if Obama loses next year and the Republicans take the Senate, then I believe they will have the power to undo it. But if he doesn't lose, you face his veto. But even if he's there, as I said earlier, I think even Democrats, even Barack Obama, is going to realize this is a big mess, and he's going to want to go in and do something about the big mess. And that's why we brought together the think tanks, the Cato Institute, American Enterprise Institute, Heritage Foundation, and others in January. And I've been working on this for 20 years. I finally got them all in the room. And I said, look, I know this day is going to come, and they're going to call in John Boehner, and they're going to call in Mitch McConnell, and they're going to say, okay, we got to change this health care bill. What do you guys want? And of course, Boehner and McConnell will have no idea what they want. So I said, but, you know, we think tanks have to get together and tell them what to say when that day arrives. And so we do have, and Joe, do we have a copy of our 10 things that most need repealing or replacing out there? Is that out? Yes, no? He says no. Okay, well, you can get it from us. And by the way, all I need is an email address. If you're really interested in health care and health policy, I send out a health policy alert on Mondays and Wednesdays. It takes you back to the blog. All I need is an email address. I'll be happy to send it to you. Yeah. Do you have somebody?
So, as a business guy, I have pretty equal power with my insurers, and I don't have any insurance arrangements where the insurers are incented to pay any claims, which you said is a problem of one of the things. So how do we set up a system where you don't have that dynamic, which you expressed was the big problem, that insurers don't want to pay for sick people. You know, they don't want to pay my property claims. They don't want to pay my D&O claims. They don't want to pay anything. How do you correct that?
Well, you know, it's not just insurance companies. Because I'm afraid the same incentives are there for the employer as well. And I don't know how large your business is. I'm a small business, and most small business people are aware of this every day, that you hire somebody that's got health problems and your premiums start going up. So we're all aware that sick people cost. And you don't want to make employment decisions that way, but we're being pushed to make it because the system is so dysfunctional. What we need is a system of personal and portable insurance. And I've been trying to get Rick Perry here in Texas and Mitch Daniels up in Indiana to really take seriously this idea of reforming the market in the right way so that employers could buy for their employees insurance that they own, and they could take it with them to their next job. And then the employer would be more like a defined contribution employer, like the 401k plan. You put up a certain amount of money, the employee puts up some money, but he makes his investment choices, he makes his health care choices, and it's not your problem anymore. And if you have insurance that travels with people, then it's more like real insurance. And insurers will have a greater incentive to try to appeal to people based on taking care of them after they have a problem.
What impact have you seen with regards to Obamacare and medical innovation? Pharmaceutical innovation or healthcare innovations with treatments? Is there any?
Well, I don't think it's going to be a good time for innovations, especially any innovations that cost money, because the pressure will be to hold costs down. And that pressure is going to get unrelenting. And you've already seen Health and Human Services doing something that's very unusual, exercising powers they really don't have, telling state governments to clamp down on Blue Cross and other insurance companies. They're trying to control premiums. Well, if you just keep pushing premiums down, That's another way of saying you better not go out there and buy the expensive treatment, or you better not spend too much money on that because you'll go out of business. So pushing premiums down is one way of forcing the insurers to ration care. Sorry to bring you that news.
Well, I didn't know if maybe there was somebody trying to come up with a cheaper solution that could potentially help out with innovation, or if it's just being squashed.
Well, I do agree that our healthcare system is bureaucratic, and it's not a market-based system. And if it were market-based, we get more of the innovations that do lower costs and improve quality. Whereas right now, the innovations tend to be of the type that maximize against reimbursement formulas. You've been a very good audience. Thank you very much.